Hey everybody, it's Dr. Alex Earle, and we're not here at Pure Plastic Surgery today. I'm in my sanctuary, as we're all told to kind of shelter in place. And I attempted to do the live today on IG, but there were some issues with connectivity. I think perhaps some issues with Instagram itself. So we're going to do a video today instead, okay? And so what we're going to do is we're going to be answering just several questions. I had asked a lot of the ladies here on the Facebook group kind of what they wanted to talk about. We got a great response, over 100 comments or so. And so they've asked quite a few interesting questions. So I'm going to try to get to as most of those as I can. I may not be able to get to all of them, but I will do a fair bit. And it does discuss, a few different subjects here, okay? So let's kind of dive right in. One of the first things that they asked was, Doc, what can we do in terms of self-massage, especially some of the ladies that had surgery, I guess, within the past, 6 weeks or so. It's been, more and more difficult to try to find a massage therapist to come to either the house or for their place to be open given the circumstances, and so they've had to kind of deal with either self-massage or having their caregiver or significant other do a massage for them. So I reached out to Coraito. She did make a video. She has that on her Instagram. We also posted it in the Facebook group. So please kind of look at those. But she does recommend using a roller to help with the self-massage, okay? And so with the roller, you kind of start towards the top and you go towards the bottom, because the lymph nodes are in the groin area, and you want to try to kind of push that fluid towards the groin area, towards the lymph nodes, so that your body can then eliminate it, okay? So she gives a pretty good explanation there. She also has some recommendations for the roller, so I recommend that you go to her Instagram and check it out. And if you have any further questions, go ahead and send her a DM and she'll be happy to answer. All right? Okay, the next question regarded post-op care for tummy tuck. So let's talk a little bit about that. As you know, I do use drains for the tummy tuck. We get 2 drains, and they're typically in for about 7 to 14 days, depending on the patient. Some patients may be a little bit longer. Whenever you come down here from out of town, you do have to prepare for the possibility of having a drain when you go back home. So you want to make sure that you, talk to your PCP or a nurse or someone who's going to be able to take that drain out for you. You don't want to end up like in an ER and urgent care for a drain. They usually won't do anything for you and they get upset. So, figure out an alternative plan. Okay. Now, while you do have the drains in place, you will have an abdominal binder. Okay, it's kind of a white thing that kind of wraps around you. At the beginning, you're going to walk a little bit hunched over, and you want to also sleep either in a recliner or with 2 pillows behind the back and 2 pillows underneath the knees. Okay, the reason that is to relieve the tension over the incision. All right, now you'll start to walk a little bit more straight, and you can sleep a little bit more straight at around the 7 to 10 day mark. All right, when things are stretched out a little bit. In terms of massage, you don't want to do aggressive abdominal massage at the beginning. You can do massage to the flanks and the waist, and believe it or not, even though we haven't done surgery there, you can do massage to the lower back, as this tends to kind of tense up and ache a bit due to the fact that you have to walk hunched over. Okay, so you can certainly do massage to those areas from the very beginning, but in terms of lymphatic massage to the front abdominal area, you want to wait at least 2 weeks to give some initial healing time, and even then you want the massage to be kind of moderate in pressure. You don't want anything too aggressive to that area, so you want to make sure you go to a massage therapist that really knows what they're doing, that they're not going to do any damage either to the belly button or the incision. Okay, all right, and then long term, in terms of 6 weeks, it's 6 weeks of no heavy lifting, no strenuous activity, and also no swimming or submerging the body underwater for those first 6 weeks. Okay. Now the drains, the key to the drain is once it's less than 25 cc's in 24 hours, that drain is ready to be removed. And then once both drains are removed, you can switch from the abdominal binder to the faja, okay? How long do you wear the faja? Well, that's very patient dependent. It's going to be a minimum of 3 months, but there's some patients that wear 6 months, some patients wear it even longer, okay? It does take a long time for the swelling after tummy tuck to go down completely. It's in the order of several months. All right. Okay, so the next topic they asked about was regarding body tight and face tight. Kind of give a brief overview, talk a little bit about fat harvesting with this, a little bit about aftercare and results. All right, so what is body tight and face tight? I do have some videos with more detail, so I'm just going to give a brief overview here today. But if you want to check those videos out, you can always go to the Pure Instagram, so the Pure Plastic Surgery IG. You can hit the little IG TV icon. It looks like a little TV in the middle there, and then you're going to see several videos there with past live topics such as Molly makeover, fat necrosis, body tight, face tight, and things of that nature. All right, so what it is, it's radio frequency energy, and so the way the body tight works is actually kind of two probes. One goes over the skin, one goes underneath the skin, and it imparts energy to that skin, and that energy brings up its temperature, and it causes the skin basically to contract. Okay, so that's the way it works. It works best after you place the tumescent fluid, so the same fluid that we do use for liposuction. We place that fluid first, and then you can do the body tight. That's when it works the best. And then, you know, after that you can follow with the liposuction. Now, for those patients where we really need to use, you know, all the fat because they don't have much fat on them, then sometimes we have to reverse the roles. We have to do the tumescent and the liposuction and then the body tight, because once you use this body tight, that fat is essentially melted and is no longer viable for transfer. Okay. All right, aftercare for body tight is very, very similar to that for liposuction. So it does involve the compression garments, okay, in a similar fashion as we do for liposuction. All right, and then in terms of results, it's a single treatment. It doesn't require multiple treatments. But the cool thing about it is that the results, you know, the tightening of the skin continues to improve over the course of the first 4 to 6 months. Okay, so that's pretty cool. And, you know, it just gets better and better over that course of the first 4 to 6 months. So you do have to be a little bit patient with it, but you're going to see how those results really start to stand out around that 4 to 6 month mark. Okay. All right, so the next question then was somewhat related, but it had to do with compression after liposuction. So yes, any area that gets liposuction, any area that gets body tight requires compression. Okay, so of course for the abdominal, flanks, waist, back area, you use your faja or your garment. Okay, the arms, initially you're going to use a wrap, and then once you have some of that initial swelling comes down, you can switch to your arm garment as well. And for the thighs, typically the fajas that go down close to the knees are sufficient compression for the thighs as well. And then if you do the chin, then there's an additional garment that kind of wraps around the head for the chin. You want to use these garments 24/7 or pretty much all day, all night for the first 6 weeks. Okay, and then after that you can cut down to approximately 12 hours a day. And then how long do you do that? Well, it's going to be again a minimum of 3 months. But some patients decide to wear it for an extended period of time. Okay, all right, so that covers kind of compression. There was another question about realistic expectations and foundation. So this is very, very important. So it's part of my job to try to explain to the patient what type of result they can expect, and to make sure that what they're thinking is going to be their result is actually achievable. Okay, that's why a lot of times, you know, wish pics are not great, because a lot of times patients tend to choose wish pics of like a celebrity or someone who's, you know, famous on Instagram, and they're starting off with a very, very different foundation. And also a lot of times, you know, we don't realize it because they don't say it, but a lot of times these pictures on Instagram and these celebrity pictures are either, you know, photoshopped or airbrushed, and you can't, you know, and they don't actually look that way when you see them in real life. And the thing is, of course, few of us actually get to see them in real life. Okay, so that's why sometimes wish pics are not as helpful. But what is helpful is usually kind of getting your own photo, your own pre-op photo, okay, and then doing some Photoshop to that, and then kind of putting it in a shape that you like, okay. And so when you do that, then those tend to be kind of the expectations are a bit more realistic, okay. If you're going to use somebody else, and you want to make sure that their pre-op in terms of, you know, their height, their weight, their BMI, the shape of their body is very, very similar to yours, so that, you know, potentially then the post-op can be achievable. All right, having said all that, everybody's journey is different. You know, no two people are exactly alike. I always like to say that our patients and our pearls are very, very unique, and you have to understand that as well. So, you know, the best thing to do is not really to compare yourself to others, but to compare yourself to you. Is, you know, your after significantly improved from your before, and if it is, then that's great, that's awesome, and you shouldn't really strive for looking like somebody else or trying to achieve some sort of perfection standard out there. All right. Okay. All right, there was a question about fat necrosis. So I saw that question. I actually discussed that somewhat recently in one of my other lives, and so you can find that on the Pure IG, again on the IGTV. So go there, check it out. There's about a 10-minute or 14-minute or so discussion regarding fat necrosis. So please go and check that out. Okay. All right. Somebody asked, what are the different options for your thighs? And typically it's the inner thigh. All right. So in terms of the inner thigh, it really depends on how much skin laxity there is. Okay, so if there's little skin laxity and it's mostly fat, then liposuction tends to be a good option because you can remove that excess fat, and then the skin will retract, and you'll get a nice result from that. If there's moderate skin laxity, then you want to consider using BodyTite for that area. So that way, you're not only doing the liposuction, but you can use the BodyTite, which is then will cause some of that skin retraction, and you'll have a much improved result as opposed to doing liposuction alone. But you get to avoid the kind of the long scar, that long vertical inner thigh scar. Now, if you have a lot of skin laxities, they're kind of for the massive weight loss patients, those that have lost 100 pounds, 120 pounds or so, then the recommendation is typically what's called the vertical thigh lift, so you're able to remove all that excess skin, some of the fat with it as well, and tighten things up that way. Now, that scar is going to be a visible scar. It kind of goes from the groin to just above the knee. So if you're wearing shorts or something, or certainly if you're like in a swimsuit or a bikini, that's going to be visible. So the patient has to be aware of that. And that's why the BodyTite has become kind of a really useful tool for those that don't have that extreme skin laxity, because it can certainly improve the area without leaving that long kind of, wide scar. Okay. It does tend to be a wide scar, similar to the ones for the arms, because it's areas that we use all the time, that we're moving all the time. It's also a circumferential area, and so there's more tension on that scar, and it does tend to heal more widely than, say, the breast scar or tummy tuck scar. Okay? All right. Okay, so then the next thing was they wanted to talk about tummy tuck versus lipo 360, and how do you know, who's the best candidate for what. Again, this has to do with skin laxity. So if the skin feels fairly taut, it has good elasticity, if there's not a lot of stretch marks, then for the most part, then that is a good patient for a lipo 360. Okay. Now, if you have a significant amount of skin laxity, so multiple pregnancies, massive weight loss patients, then those patients are good candidates for a tummy tuck. Okay. There's different types of tummy tucks, or different degrees of tummy tuck. There's fleur-de-lis tummy tuck, extended tummy tuck, your regular kind of run-of-the-mill tummy tuck, and then your mini tummy tuck. And again, all these things depend to varying degrees to how much skin laxity there is. And then, of course, the best way to determine what you're a candidate for is to send in your questionnaire, send in your photos, your evaluation, so that then we can take a look at everything and make the best recommendation for you. All right. Okay, so the next question was about blood pressure, and I think I'm just going to kind of broaden this out to kind of any comorbidities. So if you have hypertension, high blood pressure, or if you have issues with your thyroid or you're diabetic, that does not rule you out from being able to have surgery. Now, what we do need, though, is for those conditions to be controlled. Okay, so if you have hypertension but you're on your medications and that controls your hypertension, then that's okay. But you can't come in the day of surgery and have a blood pressure that's 180 over 110. Okay, we're not gonna be able to do the surgery like that. We're gonna have to cancel you. So as long as these things are controlled, your blood pressure, or whatever it may be, your diabetes or your thyroid, then certainly we can then go ahead and proceed with the surgery. For diabetes, your hemoglobin A1C has to be 6.5 or below, and for thyroid, all your thyroid numbers, so your T3, T4, your TSH, all that has to be within normal limits, and you have to be, obviously continue your thyroid medications. Okay. All right. Next question was differences between round 1 versus round 2 in terms of liposuction or lipo 360, lipo 360 BBL. So there are a few differences, and it's kind of the rule of diminishing marginal return. So unless it's been many years, or there's been a big difference in weight, typically you can remove